question. Right, so if you have read and understood, considering its surgical and optimization, kindly please tell me if you can identify this structure. What are you looking at? What is this?
This is the base of the skull from
Yes.
superior.
Which view? Okay. Can you please identify what is this number 11?
Foramen magnum.
What structures passes through it, please?
Structures passing through it mainly medulla oblongata, terminal portion of the medulla oblongata, and the spinal root of accessory nerve, vertebral arteries, anterior and posterior spinal arteries, and some soft structures like a part of dens and the.
Did you mention lower end of medulla oblongata?
Yes, ma'am.
And there are tectorial membranes.
Tectorial membranes.
Yes.
Yes.
Okay. Can you please tell me how would you divide the base of the skull for descriptive purposes?
I will divide it. It's divided into anterior, medial, and posterior cranial fossa.
Yes.
By some landmarks, like anterior fossa and medial cranial fossa divided by the boundary formed laterally by the free margin of lesser wing of sternal bone, along with anterior clinoid process and anterior margin of the pre-chiasmatic groove. And the medial cranial fossa and posterior cranial fossa divided by the superior part of the petrous part of temporal bone and the groove for superior sagittal sinus along with the posterior cranial process in its medial part. And yes, this is the landmarks.
All right. Okay. Can you please tell me if you can identify or if you can identify trigeminal impression in this base of the skull? Which one would that be?
44, number 44.
Yes, Thomas part. Yes, okay. Can you tell me what are the structures which attach on the styloid process?
Styloid process attached to some muscles like styloglossus, stylopharyngeus, and stylohyoid muscle, and some ligaments like stylomandibular ligament.
Okay. Can you please tell me in which conditions would you find lytic lesions in the skull?
There may be secondary metastasis, secondary bony metastasis, or primary malignancies like multiple myeloma, Paget's disease of bone, other benign conditions like sarcoidosis, osteomyelitis, hemangioma also.
Okay, can I ask you to identify certain structures for me? Can you identify number 42, please?
Yes, ma'am. Superior orbital fissure.
Right. Can you please identify right over here number? Where is my picture? 30, please.
Number 30 is the jugular foramen.
Yes. Yes. Correct. Right. If you can identify, you've already told me number 44.
Yes, ma'am.
All right. 8, please, if you can identify.
Where 8 is the dorsal sella.
Okay. Number 1 over here with my cursor.
And 59 process.
32, please.
32 is the superior margin of lesser wing of spinal bone.
Okay. Moving down here. 13, please.
13 is the foramen rotundum.
12, please.
Foramen ovale.
Right. Did I ask you 14?
14 foramen spinosum.
37, please.
37 is the petrous part of temporal bone.
All right. Okay. If we can quickly go through, if you can tell me, if you can name few tumors which are found on the posterior cranial fossa.
Few tumors like acoustic neuroma, hemangioblastoma, ependymoma.
Okay. Medulloblastoma. Okay. Yes. All right. If you can, in the base of the skull, if you can identify crevice.
Crevice is number 4.
All right. Good. Okay. If you can please tell me in this, yes, you've already identified, but I want you to tell me what passes through foramen lacerum.
Foramen lacerum, superior, it is traversed on its superior aspect by internal carotid artery, but does not traverse the foramen.
Yes.
And along with it, the pterygoid, nerve pterygoid, nerve to pterygoid canal, and also vessel artery to pterygoid canal.
Okay, good. Can you please, in the image, identify cribriform plate?
Cribriform plate is number 5.
Okay. Can you also identify optic canal?
Optic canal number 34.
Yes. Okay. Right. If you can also tell me, you've already maybe told me jugular foramen.
Yes,
Can you
30.
identify?
Number 30.
Okay. Right. What passes through jugular foramen?
Inferior petrosal sinus,
Yes.
terminal portion of the
Internal
sigmoid sinus, turning into internal jugular vein, and
internal.
into 3 nerve,
Yes.
vagus, dorsopharyngeal, vagus, and accessory nerve.
Yes. Good. All right. If you can also tell me the content of the optic canal. Can you identify it here?
Number 34.
Very good. All right. If you can please tell me the contents.
Optic nerve and ophthalmic artery.
Yes. And sympathetic nerves as well.
Yeah, it's sympathetic.
All right. Optic nerve also has 3 layers of its
Here,
meninges.
grammar.
So please, yes, keep all these details in your mind. Right. Can you tell me what are the, all right, we've already discussed the primary tumors of the posterior cranial fossa. Sometimes lesions also present from other parts of the body, and they appear as lytic lesions in the skull. Can you name few conditions? Yes. Carcinoma. Begin with the carcinomas, then the skin conditions.
Carcinomas, any secondary metastasis?
Yes, like skeletal from any other part of the body, right?
I mean,
Then
like
there could be multiple myeloma, there could be Paget disease, there could be sarcoidosis, could even be osteomyelitis, meningioma, etc. Very good. Excellent. Good. Thank you.